The American Academy of Pediatrics defines SIDS as the sudden death of an infant under 1 year of age, which remains unexplained after a thorough case investigation, including a complete autopsy, examination of the death scene, and review of the clinical history. SIDS is the most common cause of infant death in Canada and the US after congenital abnormalities and prematurity. The following are recommendations from the American SIDS Institute for reducing the risk of SIDS. Place infants to sleep on their backs. Infants who sleep on their stomachs and sides have a much higher rate of SIDS than infants who sleep on their backs. Place infants to sleep in a crib or bassinet with a firm mattress. Keep cribs free of toys, stuffed animals, and extra bedding. Sleep clothing, such as sleepers and sleep sacks, are good alternatives to blankets. Soft mattresses and heavy covering are associated with the risk for SIDS. Keep your baby's crib in the parent's room until the infant is at least 6 months of age. Studies show that infants whose beds are close to their mothers are the safest. Do not place your baby to sleep in an adult bed, as the baby could roll or fall out of bed. Do not fall asleep with your baby on a couch or in a chair. Do not overclothe the infant while they sleep. Set the room temperature in a range that is comfortable for a lightly clothed adult. Overheating an infant may increase the risk for SIDS. Do not expose the infant to tobacco smoke, and never allow smoking in a room where babies sleep, as exposure to smoke has been linked to SIDS. Breastfeed babies whenever possible. One study found that breastfeeding reduced the risk of SIDS by about 50%. Avoid exposing the infant to people with respiratory infections. Ensure everyone washes their hands properly before they hold your baby. Offer your baby a pacifier. One theory supporting pacifier use suggests that it lowers a baby's arousal threshold, allowing them to wake easier in case of a life-threatening event. Another theory is that they become accustomed to mouth breathing in case the nose becomes obstructed. If your baby has periods of not breathing, going limp, or turning blue, tell your pediatrician at once. Thoroughly discuss each of the previous points with all caregivers. 1 in 5 SIDS deaths occur while the infant is in the care of someone other than a parent. Although it is not possible to prevent all SIDS deaths, by following the previous precautions, you can reduce the risk of sudden infant death syndrome.